Hello everyone. Our topic for today's discussion is metabolic syndrome. Let's see the definition of metabolic syndrome. Metabolic syndrome is not a disease. Actually, it's a cluster of, you can say, conditions or risk factors which, if they occur together, they can increase the risk of heart disease, stroke, and type 2 diabetes mellitus in an person. And these conditions or risk factors are increased BP, high blood sugar, that may be due to the insulin resistance, excess body fat around the waist, and such kind of body is known as apple shaped body, as we can see in this picture, abnormal cholesterol or triglyceride level. So these are the conditions oblique risk factors. There are some other names for metabolic syndrome. It is also known as syndrome X, insulin resistance syndrome, beer belly syndrome, dysmetabolic syndrome, and as well as it is known as Revans syndrome. Let's see the background of the development of this metabolic syndrome. So in 1988, first time Gerald M. Revan, during the Banting lecture, he introduced this concept of metabolic syndrome in front of the world, and he postulated the common etiology of insulin resistance for syndrome X. He also conveyed that the metabolic syndrome is a constellation of cardiometabolic factors, and all these cardiometabolic factors, if they are present in an individual, can increase his chances of atherosclerotic cardiovascular diseases. So Gerald M. Revan was the person who first time introduced this metabolic syndrome or syndrome X. So over the year, various organizations and associations, they give different definition of this metabolic syndrome, and in these various definitions, there were various risk factors which were included, and also the cutoff level of these risk factors were also different in such different definitions. So to remove such confusion among the researchers, one harmonized definition of metabolic syndrome was given. In this, the 4 risk factors and their criteria were included to define a harmonized definition of this metabolic syndrome. The first one was the central obesity, and this central obesity is measured by measuring the waist circumference. And for the central obesity or waist circumference, criteria was if any man is having more than or equal to 90 centimeter of waist circumference, or any woman if she is having more than or equal to 80 centimeter of waist circumference, then this risk factor is positive for the metabolic syndrome. The second risk factor and criteria was the lipids level. So in this, triglyceride and HDL level were included, and as per this criteria, if triglyceride level is more than or equal to 150 milligram per deciliter, if HDL level is less than 40 for men and if less than 50 for women, then for this criteria, this risk factor also, the metabolic syndrome is positive. Apart from if person is taking any kind of treatment for the lipid abnormality. The third risk factor and criteria is blood pressure. So if blood pressure level is more than 130/85 or equal to 130/85 mmHg, or if any person is on treatment for hypertension, in such condition, this criteria also is positive for the metabolic syndrome. The fourth risk factor is insulin resistance, means if fasting glucose level is more than or equal to 100 milligram per deciliter, or if any person is taking treatment for the elevated glucose level. So in such condition is positive for this risk factor. However, to define or to say the metabolic syndrome positive for any person, in that condition the person must have central obesity. This should be mandatory to be positive for that person. And if any or two or more of the other criteria out of these three, a person is centrally obese and if he is positive for two or more of the above three criteria, then he will consider to be positive for the metabolic syndrome, means he is in risk to develop the cardiovascular diseases, diabetes mellitus and strokes. Let's see some causes and risk factor for the metabolic syndrome. So we have in previous slide we have already studied that central obesity is itself a strong positive risk factor to develop metabolic syndrome. Apart from that, there are some other risk factors to develop the metabolic syndrome, like age. If age increases, then there is higher chances of development of metabolic syndrome in the person. Second is the ethnicity. It has been found that the black men are less likely to develop the metabolic syndrome as compared to the white men. However, the black women have higher risk to develop the metabolic syndrome than black women. So ethnicity matters to be positive for any metabolic syndrome. Third one is family history of metabolic syndrome. If the metabolic syndrome is already present or already a risk factor for that family, it means that person belonging to the family have higher chances to develop the metabolic syndrome. About the obesity and overweight, we already know that this is a strong risk factor. If person is already developed diabetes, in such condition also he is most strongly positive for the metabolic syndrome. Apart from that, there are some other diseases. If any person is having in such condition, there is higher chances to be positive for the metabolic syndrome. Such diseases are obstructive sleep apnea, chronic kidney disease or non-alcoholic fatty liver disease. If any woman is already positive for polycystic ovarian syndrome, in such condition also there is higher risk to develop the metabolic syndrome. Apart from that, this metabolic syndrome is positive to be with other diseases if any person is having. So let's see what are the complications which a metabolic syndrome positive person can develop. Person can develop type 2 diabetes mellitus. There is higher chances to develop heart and blood diseases. Person can have atherosclerosis and there is higher chances to develop stroke. Person can develop kidney disease also. As we have already studied that non-alcoholic fatty liver disease occurrence chances are higher, and person can also develop the peripheral artery disease. Let's see how we can prevent or reverse this metabolic syndrome. The first one is physical activity. If any person is doing 150 minutes per week of mild to moderate of exercise, he has less likely to develop metabolic syndrome. Person should consume a healthy and balanced diet, means he should consume green leafy vegetables. Fruit should be a part of his meal. He should include the grains in his diet which are fibrous. Third one is avoidance of the processed food which contain sugars and preservatives. Person should focus on his fat. He should consume less saturated fat as well as less amount of salt in his diet. Person should avoid sugary beverages, and these beverages should substituted by the 0 calorie food options. As we already know that central obesity or overweight itself is a strong risk factor to develop metabolic syndrome. So person should focus on reducing his weight. Apart from that, smoking and alcohol consumption is found to be related with the metabolic syndrome. So person should avoid such substance also. Our metabolic syndrome concept has some controversial element as well. The first controversial element is that the present definition, harmonized definition, doesn't include some strongest risk factors, which are also a very strong factor to develop atherosclerotic cardiovascular disease. These are cigarette smoking, LDL cholesterol level, as our present definition only include the level of triglyceride and HDL. The second controversial thing is that there is poor agreement between our present harmonized definition and between the other already existing validated scoring system such as Framingham risk score. The third and very important controversial method is that the present definition includes the person who is already having type 2 diabetes mellitus. However, it is recommended that this definition should include the person who was having pre-diabetes, as it will add much more validation and much more benefit for calculating the metabolic syndrome risk factor. So this controversial element should keep in mind in respect to the metabolic syndrome. So we have come to the end of this video. If you have any feedback, if you want to comment, please comment and give your feedback in comment box, and please also like this video and share this video with the others. Thanks for watching this video.